listen to this, right? Tingling and numbness, weakness of limbs beginning with the feet, then onto the knees and hips, and eventually loss of balance, or you are so weak you simply cannot get out of bed. The South African Health Products Regulatory Authority, SAHPRA, has confirmed the second fatal case of Guillain-Barré syndrome linked to the COVID-19 vaccine, this one made by Johnson & Johnson. The first death, classified as a vaccine product-related death, was confirmed in August. SAHPRA says GBS is a very rare but potentially severe neurological adverse event that is associated with the administration of various vaccines and other medicines, and can also be triggered by some bacterial or viral infections, including SARS-CoV-2. For more now, we are joined by the South African Health Products Regulatory Authority CEO, Dr. Boitumelo Semite Makokotela. Thank you so much for your time and good morning. There are many people, of course, who have long been hesitant, and they are likely to say, aha, we told you these were dangerous. What's your response?
Good morning, Bongani and your listeners. Thank you for having me. So, certainly we would understand if the public is concerned, but I think the comfort that the public must have is that we have been monitoring, any reported adverse events following immunization and conducting causality assessments and communicating whatever outcome that we see, as we've seen now with these two cases. And, what I could also say to the public is that with a number of health products, you do have adverse events. But the critical thing is that you must know them, and then those must then be effectively managed by the healthcare professional. So in this case, the professional information of the Janssen vaccine does indicate this as a risk. And so, if anyone is aware of having experienced such in the past, they must highlight this to their healthcare professional.
And the important thing, of course, to underscore is that the overwhelming majority who were vaccinated displayed no adverse effects.
Certainly. These two cases, which are very unfortunate, and, the Department of Health has engaged with their respective families. So condolences to these families. But these are two cases out of the 9 million Janssen vaccines that have been administered. But also we need to consider the lives that have been saved by the use of these vaccines.
Some will say, how do we know though, doctor? Anecdotally, there are many who believe their loved ones were harmed by the shots, but they simply can't prove it.
Sure. So, we've received a number of reports because we monitor these very closely. We've received a number of reports on any adverse event, and a number of these events have cleared within a number of days, 3 days, 4 days. We have had those like these two cases, which we have causality linked. There are other cases that we have done the causality assessment, and we can say with confidence that those were not linked to the COVID vaccines. We have reported in the past some of the deaths that were reported, and those were coincidental, not related to the COVID vaccine. So I think it's really a matter of engaging with your healthcare professional, reporting. The critical thing is that these need to be reported to us, and we need to investigate them.
Is there any argument to say, look, for every confirmed case, there might likely be more, but perhaps underreporting is a thing, and there's obviously also resources to, find a health practitioner to report what symptoms you may be experiencing and so on?
Sure. That's a very valid question. And when we look at this data, we don't only look at data in South Africa, we look at data globally. So we work closely with the other regulators. And what we have seen is that there is certainly cases of GBS that have been confirmed in other countries. And the incidence that we're seeing in other countries is about 5 individuals in a population of about 1 million vaccinees. And so that's the incident that, has been reported globally. In this country, we've only, been able to link the 2 cases. So we are considering all data across the world, but this risk is certainly there. And, we really encourage the population to report any possible adverse events that they may be experiencing.
All right, I highlighted some of the symptoms based on my very limited knowledge, Doctor. I'll let you be the expert. What is Guillain-Barré syndrome?
Sure. So Guillain-Barré syndrome, which we loosely call GBS, is a syndrome whereby your immune system basically targets your neurons, right? It destroys your neurons, and the initial feelings you'll feel like a loss of feeling in your limbs, and with time we've seen that the patients struggle with breathing, with swallowing, etc. So those are the critical symptoms that one must look at, and this. Typically, we would see it between 5 and 10 days post-vaccination. So the individuals must certainly look for this. In the cases of these two deaths, what we saw was respiratory failure. In some instances, we even saw septicemia leading to death.
Was age a factor at all? I understand one of the cases was over 80 years old.
Certainly not a factor. The two cases that we have done, so we have other cases that have been reported. We are investigating those. The two that we have concluded the causality assessment of, these were individuals that were between the ages of 45 and 50. And so, we can't say whether age is a factor because these are the two dates that we have seen causality assessments. Yeah.
All right. Look, here we are all this time later. The vaccination rates remain low, broadly speaking, in terms of what we had laid out as our ambition as a country. Lessons learned there, perhaps?
Certainly. I mean, for us as a regulator, a key lesson that we have learned is around engagement with the public, extensive engagement. Also engaging the public in our indigenous languages. So we've got material that's available to explain to those, that may need further clarity in our indigenous knowledges, is to do that. But third, the second lesson for us is we have to go out on a serious campaign to educate the public around how to report adverse events. And it's not only for vaccines, but for many other therapies. And so that's going to be the big priority for us as a regulator.
Do you think, looking back, perhaps instead of going for the general population, the focus should have been really about the vulnerable and those who had pre-existing conditions that might have exposed them to complications as far as COVID-19 is concerned?
Yeah, so I mean, initially that was the thought, right, that those who are at high risk with some predisposition or existing conditions are at high risk. But what we've seen is that in some instances, even when the risk level is quite low, people do experience some of these adverse events, and hence we're taking a very general stance because, again, there's still a lot that's not known about this disease. But certainly those with high risk, we have prioritized it, but it doesn't mean those with no risk factors may not experience these side effects.
And perhaps one thing to dispel, Doctor, is this idea that, all right, I've been vaccinated, I've had COVID, if I have it again, it probably will be okay. Over time, we still don't yet know what the impact of contracting COVID might be repeatedly. Is that right?
That's absolutely correct. I mean, so we have, it's been termed long COVID. And there's a lot that we still don't know about that. I think with time, we will be able to tell, but at the moment there's a lot unknown. So we still urge the public to be, safe. We still urge those who have not received vaccines to get vaccinated because, again, it's so unpredictable at this point.
All right, appreciate your time there. That is Dr. Boitumelo Simete Makokotela, who's the CEO of the South African Health Products Regulatory Authority.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.